Permanent partial disability is just one way that we can attempt to resolve these workers' compensation cases at settlement or at hearing. Permanent partial disability tries to compensate an injured worker for the loss of a specific body part that you suffered the injury for. We look at things in percentages, and so, for example, if you break your wrist, we might attempt to argue that under the theory of permanent partial disability, that hand and your wrist is now 20% no good, for lack of a better word. Every single percentage point of that body part is assigned a certain number of weeks of pay at your disability rate. And so at the end of the day, it comes down to simple calculations and math to determine, based upon your average weekly wage and your disability rate and the percentages that are appropriate for your disability, what is a lump sum that would be appropriate to compensate this injured worker after that injury. There's a variety of factors that the Commission looks for under the statute for PPD, or permanent partial disability. They look for the American Medical Association guidelines, the AMA guidelines, which attempts to help guide them as far as what's an appropriate percentage of loss of use for each body part. Other important factors include the employee's age, the occupation, any evidence of a loss of earning capacity, and finally, the medical records themselves and any evidence in those medical records of a disability. A good example would be if a doctor in the medical records indicates that you're unable to lift your right arm above shoulder length permanently because it's going to cause you too much pain. That's the kind of evidence of disability that we and the Commission would look for in attempting to argue for a higher award of permanent partial disability, because it's objective evidence of a disability.